Starting to slow, so I think we are good to go.
Very good. Thank you. Good afternoon, everyone. Thank you for joining me in our breakout room today. My name is Dan Jurman. I am the Executive Director of the Pennsylvania Office of Advocacy and Reform in the Office of Governor Tom Wolf. I'm here today to talk to you about our trauma-informed PA plan, how we got started, what's in it, and then where we are so far today. And next slide, please. So our office was formed in July of 2019 with a focus on better serving vulnerable populations across the Commonwealth of Pennsylvania. And there was also a council on reform that was created at the same time within that executive order that came up with 121 different recommendations for the new Office of Advocacy and Reform. Within that executive order, though, there was also the statement from the governor that he wanted Pennsylvania to become a trauma-informed state. That really struck me when I joined the office in December of 2019, because in my work with multiple vulnerable populations, I had come to see over time that whether it was my work with people with intellectual disabilities, working with at-risk youth, working with seniors, I worked for two different federally qualified health centers, one rural, one urban. I worked in a community development corporation. I worked in a community action agency, and I worked in 3 different states, and very different states: New Jersey, Florida, and Pennsylvania. Most of that time in Pennsylvania, but saw over time that trauma kept showing up over and over and over again. And as I read through the 121 recommendations that the council had created before I had started in the job, I could see that same theme of either the trauma that brought people into service or the re-traumatization of people once they were receiving services. And so I felt, as someone who has focused a lot of my anti-poverty work in my career on public health approaches, getting to the core cause, not just the symptoms and making people feel better while they remain stuck within the thing that's harming them, but what is the core cause where we could actually affect this issue more deeply. That going after trauma was a way to get not just at a core cause for poverty, which so much of my career had been focused on, but so many other community ills that have been with us for time immemorial. From all the things listed here, all the way to COVID-19 and the traumas that we've shared together over this past year. And so another way to look at that is on the next slide. And here there's a principle within public health called a syndemic, and that's when you have a set of linked health problems involving 2 or more afflictions, but they're interacting synergistically. And so I've kind of taken that concept of a syndemic and taken these different community ills and kind of created my own Venn diagram to make the point that that area of synergy around these different community ills, while not everything to them, not the only cause, is trauma. And it shows up over and over again in all of these issues that we're trying to solve. And in many cases, especially in Pennsylvania, we have 67 counties that all do very different things in lots of different fields, whether it's juvenile justice, long-term care for seniors, children and youth services. There's inconsistencies. And part of that is because we don't have the same culture. We don't share the same ideas about how to do this work and how to be person-centered and preventive. And so going after trauma, in my mind, was a way to serve all of these vulnerable populations and at the same time start to make real progress against some issues that have been with us for far too long. Next slide, please. One of the reasons that trauma has such a huge impact, and I recognize that there may be folks in the breakout room with various understandings of trauma and different starting places. So I apologize if some of this is repetitive for some of you. But the brain treats chronic stress, scarcity, and abuse and different dangers in very similar ways. And that is by shutting down the part of itself that is in charge of executive function, emotional regulation, problem solving, critical thinking, which is often the part of your brain that you need the most in some of these situations. And so that takes a toll, especially when the danger or the scarcity or the chronic stress doesn't go away quickly, but persists for long periods of time, in some cases generationally. That starts to change the way the brain reacts to things. You become hypersensitized, and it affects your ability to succeed and thrive. These systems, this idea of your brainstem taking over in times of danger or high stress, that was designed to keep us alive in a much more primitive time. Now in modern society, the same thing that was helping us survive an attack from a wild animal is making it hard for us to succeed in civilized, polite society. And so that child who's constantly experiencing toxic stress or abuse and trauma can't focus, it can't access their executive function in school when they're triggered by something. The same thing for that employee who was struggling in poverty, and we help them get a great job, and then they end up getting fired or quitting soon afterwards because they couldn't acclimate to that work environment because we hadn't actually addressed some of the stresses and traumas that they had experienced before we got them the job. And so we have to think about this work differently now that we have a different understanding of neurobiology, and we understand that that neurobiology should change the way we approach our work. Our policies, our practices have to match this. Also really important to me as someone who is doing anti-poverty work is to understand, if you look at these two brain scans, that there's a lot of similarities in a brain scan of someone who's experienced years of chronic stress and someone who has been physically abused. And to understand that that's how profound it can be. And I think more people understand that now because of COVID-19 and the fact that so many of us, if we had never experienced chronic stress before, you've probably experienced it in the last 14 months. That idea of these stressors and fears just never going away, and how much harder it is to function when that's the case. I'm a better presenter and speaker 16 months ago than I am right now. Why is that? Because it's harder to put two thoughts together. Maybe I fake it well and you think I'm doing a good job, but inside my head, I'm trying to push through, how many virtual meetings I've had today. My kids are in another room because they were in online school. I got 2 dogs that hate the UPS guy, like all these different like little stresses. And then there's big stresses. Am I going to lose my job? Are my kids going to stay healthy? My youngest can't get vaccinated yet. How much longer are we going to be locked down? People have passed away in my family that I haven't had a chance to say goodbye to. These things all add up, especially when there's no release and it just keeps going. I like the saying that we're not in the same boat, but we're all in the same storm. But that also comes with the recognition that some people's boats were sinking before there was any such thing as COVID-19. And other people had really nice boats and still do, but that doesn't mean that they're still not experiencing some things because of this storm that we're in. And so it all affects people differently. It's based on their resilience and their resources, but it affects everyone. And no one is immune from the way their brains react to trauma, stress, scarcity, and these things not going away after an event or two, but staying with us for such a long time. Next slide, please. That is especially profound when we're talking about the development of a child's brain. And in essence, a child's brain can develop almost in an upside down fashion when they're surrounded by trauma and toxic stress. And so when the brain should be developing towards social emotional maturity and cognition, instead it's holding on to that development around the survival and regulation. That amygdala, that brainstem becomes where everything is focused. Because when your caregivers, the people surrounding you who are supposed to be nurturing you and helping you move towards your self-esteem and your self-actualization, are actually the people who are traumatizing you, or you're living in trauma with them so that they can't function enough to provide that to you, then your brain focuses on survival instead of that higher level of development. And it gets stuck. And so it's very important for us to recognize not just that this happens to children and the profound effect it has there, but to the adults who are with the children. Their ability to help this go differently can be affected by us looking at multi-generational approaches to this work. Next slide, please. One of the best ways that I've heard why this sticks with us the way that it does is from a book called Connecting Paradigms by Matthew S. Bennett. And I'm paraphrasing his biography here, but if I understand or remember correctly, he was a social worker and a case manager first. And then he went back to school and ended up getting degrees in psychology and psychiatry, and then in neurobiology. And he realized that he'd hearing about all these different things, but they weren't being connected all the way back to that social worker who had to do the motivational interview with that family who was struggling with deep trauma. And he talks about a concept of snakes and sticks. And so basically, the idea is you're walking along and you see a stick. And then when you get up to it, it turns out that it's actually a poisonous snake and it attacks you. What happens the next time that you're walking along and you see a stick is your brainstem does not let you rationalize it and think through, oh no, that's just a stick. It takes over and it floods your body with adrenaline and cortisol. Your fight, flight, or freeze response kicks in, and you're ready in case this turns out to be another snake. Now imagine that every other stick that you come across every single day turns out to be a poisonous snake and attacks you. What happens is that not only does your amygdala take over um, when you see a stick, but you start to see other things that have nothing to do with that except their association around it, like the leaves on the ground or the area that you're walking through, start to trigger that response that again shuts down your problem solving and your executive function, and instead has your body flooding with these chemicals to prepare you for snake attacks because you become so used to those dangers. And that's what happens when we see things like the complex traumas connected to domestic violence or child abuse. When we see folks who live in scarcity for so long that their brain is just constantly screaming at them that they don't have enough, they don't have enough, and they have to do something about that before the brain will let executive function kick back in. That's why kids can't come to school hungry and learn anything. It's not that they're choosing not to. Their brains have been designed for them to handle their basic needs first before they can move on to the rest of Maslow's hierarchy of needs. And so we've had Maslow's hierarchy for a really long time. Now we have the technology and the neurobiology to understand why that's right, why people can't move past those levels, and what's going on inside the brain to get us hypersensitized to some of these factors and stuck. Next slide, please. So the other piece of this is, because this can all feel like it's doom and gloom, is to understand that people can heal. That I wouldn't jump into a movement if I didn't think that we couldn't heal people and help them get better. Scientists and neurobiologists and others are starting to think that brain plasticity might last our entire lifetime. But Harvard has identified, at the very least, that the part of the brain in charge of executive function doesn't even stop developing until we're about 30 years old. And so we don't have to give up. We're seeing more and more through different research and studies that new neural pathways can be created in the brain to help people get past those learned triggers from different traumas that they've experienced. And so there are some wonderful proven therapies around trauma that we know make a difference. And we also know that the brain itself is capable of healing. Next slide, please. So our approach in Pennsylvania, first of all, I kind of had this nebulous charge of make Pennsylvania a trauma-informed state. My work had been very focused from the lens of how do we look at trauma and poverty. A lot of my training had been helping people understand the traumas that exist in poverty and how people can get stuck by that context. But I don't understand the whole picture. And so my first instinct was to reach out and create a think tank of people from different disciplines and backgrounds to help me write a trauma-informed PA plan. And so in late January of 2020, we put out the call through a press release. I thought, we're asking people to send me a resume and go through an interview, and for a volunteer job, and maybe I'll get 10 people who are interested, and that would be enough for a think tank. So I was crossing my fingers and hoping I'd get 10. I got 68 applicants, and I'm not kidding. All 68 could have served on a think tank. These were great folks. We were always going to be virtual, so the pandemic, when it hit in the middle of my vetting process, didn't slow us down, because I wanted not just gender diversity and ethnic diversity. I wanted diversity in generations. I wanted different geographic diversity. Pennsylvania is a large state, square mileage wise. And we have lots of rural areas, and then of course Pittsburgh and Philadelphia and everything that's in between. So we wanted people from all of those different areas, urban, rural, suburban, and representing different cultures in different parts of the state. So It was always going to be on a virtual platform. I had learned a little bit about Zoom before the pandemic, so I felt like Zoom could be our platform. Little did I know I'd be an expert by the time we started meeting. But we ended up increasing the size of the group to 25 because of the number of applicants that we had. And we had those other 43 folks. I asked them if they would be willing to get involved in implementation after we'd finished the plan, and many of them said that they would. Our meetings were focused on 6 core topics. The first was defining terms and using common language so that we were speaking the same tongue. We didn't want to continue down this path of, one person says they're trauma informed because they went to a workshop once for an hour, and some other organization is incredibly progressive and is way beyond even where some of the writing is, because they're really thinking about how they can continuously improve, and then everything in between. And so we also didn't want trauma informed to become sort of this cliche buzzword that would go away and be replaced by something else later. We wanted this to be something that people could define and understand, so that we could all start moving together. The next piece of that was also for us to create a mission, vision, and values around our efforts, so that we could talk about why we did this work and why it was important to us to do it in a certain way. We wanted to build a network to connect and support community-based grassroots movements across the Commonwealth. We knew that some communities had been doing this work for decades. Some individuals have been doing it since the ACEs study in the 90s. And we didn't want to come into the space and say, well, we're here from the governor's office and we want to take over. We wanted to support what they had already done. We wanted to partner with them and help them do more of it and give them new resources to do it. And we also wanted to connect them to each other and to communities that hadn't even started yet, that would need peer mentorship and others to help them along the way. We wanted to prioritize changes at the state level, and key here is the word culture. Policy and practice, absolutely. But as a former nonprofit CEO, I always describe culture as the thing that everybody does when the CEO is not around, for good or ill. What's everybody do when nobody's watching? And so we wanted to build a culture that was trauma informed. No matter what the governor says or who the governor is, we wanted to embed that in state culture. We also wanted to heal from the trauma of a disaster like COVID-19 and this pandemic that we've all lived through. That wasn't on our radar of meetings earlier. We added that. But we also thought, how many times do we see stronger hurricanes and worse tornado seasons and flooding at historic levels because of climate change, school shootings and other community tragedies. So we wanted to help think about how we heal that communal trauma when a community shares a traumatic event together. And then healing the damage of racism and communal and historical trauma. And that was on our list from the beginning, but certainly the murder of George Floyd and the protests of last summer added an exclamation point to that work. Really key to us is looking at how we go after, again, that public health model, the core causes of racism, and how we do that through a trauma-informed lens instead of the typical the typical approach where we talk about it, but we never really kind of land on what we're going to do. And so we wanted to take that trauma-informed lens and figure out how do we help the folks who have experienced discrimination and racism heal? How do we help the communities that have been discriminated against heal? And how do we look at what's causing someone to have so much trauma, anger, fear, whatever that motivator is, to take that out on a whole group of people, to be ripe for what we're seeing now across the country in terms of radicalization, to join a group to actively try and harm other people, or to espouse views that another group of people is somehow less than any other human being. And so we're digging into that work and trying to look at, again, what those core causes are. How do we stop the abuse from happening? And how do we stop the radicalization? We did this work between March and June of last year. By the end of June, it was all volunteers other than me. And as I shared, I'd never worked for state government or any government before I took this job. Once we finished with all the community experts working on getting a draft together, we then sent that to different state agency representatives who were doing different ACEs and trauma initiatives within their own agencies. And then we got their input. Not to say take this out. We didn't take anything out. but to say, what are we missing? What else is there? Are we going far enough? Are you already working on some of this and we should push this recommendation even further? And so we got some great feedback from those folks. And then we put it in front of the governor and the cabinet. There were literally no edits from the governor and the cabinet that were requested. So our final draft of the plan went live at the end of July. And then we moved into the next phase. And our goal was to put together something that was both aspirational and actionable. We wanted some big, audacious goals in there, but we also wanted to show that we could get this done. We didn't want to write something that was going to gather dust on a shelf that somebody might remember, like, didn't we write that like 10 years ago and we still haven't done anything about it? That wasn't our goal here. Next slide, please. So the plan itself, you can jump one more slide, is pretty straightforward in terms of the three pillars that hold it up, which were part of those conversations. The first is those changes in state government. How do we work on changing the culture? Training is one thing, but also how do we show that what you learn in those trainings matter? And so we talked about adding trauma-informed language to job descriptions. We've talked about potentially even adding language to evaluations to show that we're watching. Did you perform your work this year in a way that was trauma-informed and healing-centered? Policies, how are we looking at policies that prevent re-traumatization of the people that we're supposed to be serving? How do we focus more on prevention? There's some great work that happened out of Alaska recently where they showed that by focusing on the 5 household dysfunction ACEs in families from pre-birth to, I believe, school age, they were able to reduce children and youth contact by over 40%. So they've done the homework to be able to show that it's been evaluated, that these are their numbers. And I know it's always hard for us to prove what we prevented by doing our work. Alaska just went out of their way to do that, to show that we could actually save both trauma and re-traumatization and money by being focused on prevention. And they're going to be publishing on that research soon. Licensing and how we make sure that our licensing isn't just about fire extinguishers and the width of hallways, but is also about the people that live in the facilities, about whether or not they're not only well, but that they're happy, that they're not being re-traumatized by their placement. And sometimes, being removed from your home is a trauma in and of itself. So how do we reduce the other traumas that are connected to that? How do we help make that a healthy space? The second pillar is around that community-based grassroots movement work. And how do we support all those different coalitions? A big piece of that for us is free training and technical support. If we're going to become a trauma-informed state, it can't just be the organizations that have a training budget or can afford a consultant. It's going to have to be tiny faith-based organizations in really rural parts of Pennsylvania. It's going to have to be mom and pop urban nonprofits that that are out in the community doing the work. They don't have sophisticated back offices. Or churches that are doing some of this work. They're all going to need to understand what trauma and ACEs are, just as any large provider is going to need to understand it. And then finally, the third pillar is that communal trauma piece, which includes that racism, discrimination, and disproportionate minority contact, as well as how we're responding to natural disasters, community crises, and public health emergencies. Creating toolkits, trainings around all of these issues so that we can help communities identify the traumas that exist, but also identify their resiliency and their strengths and how they can leverage those to process what's happened to them and heal. Next slide, please. We're going to jump, we can jump one more slide. So some things were already underway within the Commonwealth and different agencies before we put out our recommendations. And we included our recommendations anyway. We didn't kill them. We thought, well, let's add an exclamation point to these. Some of those included insurance parity and making sure that our behavioral health coverage is as good as our physical health coverage with our insurance providers. That's an ongoing battle. Telehealth coverage, we've seen by necessity what an impact that can have. We had started Your Mental Health Matters campaign prior to COVID, and the number one thing people said was a barrier to them for care was transportation. So telehealth has had a big impact in people having access, and we want to make that permanent within Pennsylvania. We've been working on a resource and referral tool, which will also have case management functionality, something that would be a shared data resource for different service providers at all levels to be able to almost have the equivalent of an electronic medical record for social services. The ability to share data and provide holistic care to people came up in our plan, and that was already being worked on in our Department of Human Services. A living minimum wage, it's something our governor just talked about yesterday in my own county. Um, we know that a certain amount of trauma and chronic stress comes from living in poverty for an extended period of time. And so our ability to pay people a living wage, and health insurance is right up there with that one, to help people stay well. If you can't get your minimum basic needs met, you're not going to move up Maslow's hierarchy. You're not going to stop feeling chronic stress. Your amygdala is not going to calm down enough for you to be able to self-actualize. Broadband access. We just announced we're investing over $300 million in broadband access. Because if you're in a rural part of Pennsylvania and you can't get on the internet and you don't have good cell coverage, your telehealth isn't going to do you any good. And then an anti-stigma campaign for mental health. These next slides, and we can move on to the next one, are going to go through some highlights on the recommendations themselves. There were 48. I'm not going to cover them all. I'm just going to very briefly touch on some of the highlights. Training to change our culture. Now, we're going to do that within Pennsylvania. All new employees and current employees in Pennsylvania are going to have to do a training on trauma. I've already canned my first training on video that is out there for new employees to take. We've distributed it through the Department of Human Services. It's a training called The Intersection of Trauma and Poverty. It's actually on our PACES connection page for Pennsylvania so that anyone in the general public can have free access to it. It's a 1-hour training on, again, on trauma and poverty. We also recommend that that there is training for anyone who's interfacing with the public, especially if they're in different serving and caring roles. Police officers, judges, parole officers, teachers, social workers, you name it. If they're connecting with the public, we want them to be required to learn about trauma and trauma-informed approaches. Next, please. Licensure based on people. Again, that whole idea that we shouldn't just be writing regulations around the safety of the space, but about whether or not the organization is trauma informed, not just for their own customers, but for their employees as well, for the vicarious trauma that their employees are experiencing. And so that work is underway as we're rewriting certain regulations right now for youth residential care, for foster care. We'll be including trauma-informed language as we work through regulations and licensure over the next several years. By the end of this calendar year, our first set of behavioral health residential providers are going to have to be trauma aware as a part of their licensure. Next, please. Expanding our ACEs definition. We certainly believe in the work that was done by the Centers for Disease Control and Kaiser Permanente in the original ACEs study. But Philadelphia also did an ACEs study, I think around 2012 or so. And they looked at a much more diverse and urban population and saw some pretty impactful differences in the rates of certain ACEs, but also they identified 5 new ACEs in that work as well. And those included witnessing violence, feeling discrimination or bigotry, living in an unsafe neighborhood, experiencing bullying, and living in foster care or another youth congregate care setting. And so again, congregate care may be the right answer for youth who are in very dangerous situations, but that doesn't change the fact that we are also creating a trauma when we do that. I myself am an 8 on the original ACEs survey. I grew up in a family that experienced poverty and domestic violence and other issues. Any case manager who had walked into my home at any given point at the worst parts of my childhood would have been putting me in a safer setting, and I would have been devastated to have been separated from my mother and my sisters. So just understanding that that we have to take that into account as we're thinking about some of the interventions that we have. We also added, and this one's been controversial, I've debated with folks from different states about this one, experiencing poverty for an extended period of time as an adverse childhood experience. The more I've learned about the neurobiology of scarcity and the kind of chronic and toxic stress that that creates, the more it's undeniable to me that while poverty can exacerbate all of the other existing ACEs, it can also be an ACE itself in the kinds of stresses that it creates for families. Next slide, please. Child abuse is a public health crisis. Here in Pennsylvania, our child abuse rate prior to COVID-19 was 38%. So 38% of all Pennsylvanians had experienced either physical or emotional child abuse. So essentially, roughly 8 out of 10 students in any given classroom, statistically, were going home to some kind of abuse and being expected to learn effectively in the classroom. And so we have to treat this like the public health crisis that it is, and work towards prevention. And we expect it to be worse from this period of pandemic and lockdown. Next, please. Requiring the evolution to trauma-informed and beyond. So we created a continuum. Actually, Delaware's continuum and model was one of the ones that we looked at. We looked at a couple other states as well. We borrowed heavily, thank you. But we put together our own continuum to go from trauma-aware through to healing-centered. It's just a guide as far as we're concerned. We really want organizations to think about becoming healing-centered as a journey that doesn't actually end anywhere. It should be continuous improvement. We should always be asking ourselves, no matter how great we are at this, are there ways to be better? Are there ways to not re-traumatize even more than we've already been focused on? Are there ways for us to be more preventive than we currently are? Those should be ongoing conversations. Are we offering enough support to our staff for the vicarious trauma that they're experiencing? And again, we think those are continuous. This was already in development within our Department of Human Services, making this part of licensure. And that is our Office of Mental Health and Substance Abuse Services and our Office of Children, Youth, and Families are our pioneers and the first ones to put these requirements of moving along this continuum into practice. Next slide, please. Getting to the heart of racism and discrimination. Again, we're really heavily focused on how do we find core causes. We're going to be working with some folks from the FBI that have been focused on the radicalization of other groups from other countries to help us understand what strategies they employ in interrupting the cycle of radicalization. We're going to be talking to and reaching out to find experts in cult deprogramming. And we also are looking at talking to folks who have left hate groups about what things caused them to join in the first place, what things caused them to leave, and then how do we create an operational strategy and tactics around stopping what we're seeing. Pennsylvania has vacillated between #1 and #2 for arrests during the January 6th insurrection. In my own county, there was a meeting of the Proud Boys here for a large group of folks before they went to the Capitol on January 6th. And so we have a lot of work to do in Pennsylvania around what's happening with racism and discrimination. Next slide, please. Connecting people and to each other during crisis and connecting them to healers during crisis. And so here we're building, looking to build out toolkits, healing circles, different ways we can equip communities to process what's happened to them and help them heal from it. A big piece of this will be some community conversations that we're going to be doing with people living below the poverty line as soon as we hit a certain vaccination level, where we're going to be talking about ACEs, trauma, and this neurobiology, but in very plain language, and talking to people about what they can do to mitigate their own stresses and understanding what's happening to them when they experience the kind of stress that comes from living in poverty day after day, and then connecting them also with local therapists and resources who will be attending these conversations with us. And these will all come with a meal and childcare and enough resources, a stipend, to make this actually easier to come to our community conversation than to stay home. Next slide, please. Out of all this work from the plan, we've created Heal PA. I know governors change, and there's every possibility in Pennsylvania the next governor won't believe in systemic racism, in trauma, in ACEs, who knows? And so we have built a public-private coalition in Heal PA that can break away from the governor's office if need be to survive on its own. It is made up of nearly 150 people right now. A handful of those are different staffers from different agencies of state government. The vast majority are trauma experts and practitioners, teachers, law enforcement, you name it, all different disciplines and fields from all over the Commonwealth who are working on different action teams to implement the plan that we've written together. A lot of those 43 people that didn't get onto the think tank are back and are part of these different volunteer groups. The other piece of this is Resilient PA. So the United Way of Pennsylvania got a grant to launch a grassroots outreach effort around ACEs and trauma. And their CEO and I have known each other for several years, working on things like the Alice Project and on collective impact projects around the state. And relationships are everything in this work, right? So her level of trust with me, she came to me immediately and said, I know you have Heal PA. We're going to do this thing. How do we not duplicate what you're doing? How do we work together? And we were able to not only figure out how to strategically work together, but complement each other. We have a lot of trauma experts, and the United Way has over 100 years of communications and networks within different communities all across our state. We don't have a lot of marketers and communicators in Heal PA. So we've decided that they're going to help us get the materials and the toolkits and other things that we create out to community stakeholders in multiple sectors and kind of be our pipeline for communications, trainings, and other things, resources that we build within Heal PA. And so we'll be working together with them to try and be more effective together. Next slide, please. So the action teams that we formed, I'll go through this really quickly. I want to leave some time for questions. But we've formed specific action teams. So Deshaun, I'm going to go through these really quickly. I apologize for your clicking finger. Next slide, please. So first of all, there's universal teams. Next. The first is community outreach and communication. So that works very closely with Resilient PA, with our United Way. We've cross-pollinated each other's teams so that we've got United Way folks serving on some of our teams, and we've got our folks serving on their teams with Resilient PA. And so including within leadership, so that we're really closely aligning strategies and actions. Next slide, please. Policy and legislation action team. So as the other teams are working, what advocacy issues come up that we need to work with our legislators on. Next slide, please. The development action team. So how do we find resources to bring into this? We are actively working to try and get some of this massive amount of federal money that's come into Pennsylvania for COVID recovery to focus on the behavioral health recovery that has to happen for all Pennsylvanians now. And so we are trying to go after some of those federal dollars, but we're also looking at grants and national grants, regional grants, statewide grants, you name it, where we have a lot of partners working together, and we think we've got a shot to make a case for why they should invest in what we're doing. Next slide, please. A data and evaluation action team. I'm really excited that this team has representatives from multiple universities and colleges working together around data and evaluation. There's a certain amount that they're doing pro bono, and then hopefully as we bring in resources to launch different pilots and our recommendations, we'll also be able to pay them to work together to do third-party evaluation and prove our results the way that Alaska has done such a great job of being able to validate their results. Next slide, please. And then we have our targeted teams. Those universal teams serve all the others. These are more focused. So a training action team to try and provide as many free training resources and training information to folks across the state as we can. Next slide. The education action team is focused specifically on our education recommendations throughout the plan. We think if we can get to children earlier, then we can do a lot more prevention and try and head off the effects of some of those ACEs. We are assuming as a state that every child now has an ACE score of at least 1 because of the year that they just lived through. And so we're looking at building a universal healing plan. We're still doing surveillance too, but we're focusing on a universal healing plan. And frankly, it's not just the students, the teachers need some healing too. As do parents. And so we want to equip parents, teachers, pediatricians, anyone who's in high contact with children to give them tools and resources to be prepared to help those kids process the year that they've had and help them heal, and probably also help themselves and their own children at home process and heal what they're going through too. Next slide, please. Racial and communal trauma prevention team. I've already spoken a little bit about that work. We're also looking at how to help communities. I'm thinking specifically right now about Asian and Pacific Islander populations. The stories that I've heard of families who are afraid to leave their apartment to go get vaccinated because they're afraid that they'll encounter violence on their way to the vaccination site. There's a lot of violence going on right now for those populations, but certainly any population, whether it be because of ethnicity or gender identity, that's been experiencing trauma and abuse, we're working on healing strategies as well as ways for communities to come together around those populations to help prevent those. Next, please. A criminal justice action team, that is a big one. and it's focused on everything from the juvenile justice system to the prison system to reentry, and lots of other things in between. So there's a lot of subcommittees within that group. We have someone from the Attorney General's office co-leading that, someone from a county deputy administrator is his co-chair, and then a lot of folks from the community and the trauma field, but also other law enforcement folks involved as well, because you need the right ambassadors to speak to crowds. I'm not the right person to talk to a police department necessarily, but another police officer or someone who's a prosecutor who understands trauma is, and so we're trying to build that bench as well. Next, please. Poverty Reduction Action Team, I've spoken a little bit about that group and our big plan around community conversations. Next, please. Business involvement. That's probably my #1 request right now for trauma training is for-profit businesses and chambers of commerce, workforce development boards, because they've recognized that their employees have been impacted and they don't quite know what to do about it. And so it's been interesting because when I think about what makes legislators pay attention, it's not old nonprofit guys like me, it's businesses, it's for-profit business leaders and chambers of commerce. And if we can get them on our side, and if we can get them helping to make trauma-informed workplaces within their for-profit businesses, I think we can get much further than we would have pre-pandemic. So we're doing a lot of education in that space with businesses. I'm actually speaking to the Philadelphia Chamber of Commerce next week about how trauma and chronic stress can negatively affect their recruitment and retention efforts. Next slide, please. Child Abuse Prevention Action Team, and we've spoken about that. That team is working on a public health campaign connected to preventing child abuse. Next, please. Organizational Support Action Team is focused on providing resources and free assessments and tools to help organizations move through the continuum that we built. Next, please. Physical and Behavioral Health Action Team is really focused more so on helping the behavioral health folks connect with the physical health folks in a different way so that the physical health folks understand how important ACEs and trauma are to our physical health. As I shared, I'm an 8 on the ACEs survey. I had to tell my primary care physician what ACEs were and explain it to him in the exam room. We should have been talking about something else by that point. It was already embarrassing enough to talk about these things, but now I've got to explain the concept to him. So we want to make sure that that folks in the physical health world understand these connections. Next, please. Some early wins you can see here. I've talked about some of these already, and I won't be redundant. Some things that I haven't talked about, our legislature has made it a requirement for all law enforcement across the state of Pennsylvania to get trauma-informed training. They've also made it mandatory for them to all get enhanced de-escalation training. Within some of the dollars that I've requested funding for both the Handle with Care program to be able to pilot that in more places. That's where police are contacting school districts if a child has been encountered during a call. And also crisis intervention teams for our police departments is something I'm seeking funding for. I would like to see that happening where police aren't the ones taking those behavioral health calls. Here in my own county in Lancaster City last year, we had a man with a behavioral health concern shot and killed by a police officer when his mother was reaching out for behavioral health support. Same thing happened in Philadelphia about 3 weeks later. We need to do a better job of making sure the right people are answering the right calls. And so we're actively advocating for funding and policies along all of these. Being in the governor's office allows me to connect with all state agencies. And I'm in a lot of meetings where I get to raise my hand and say, hey, how do we make that more trauma informed? How do we make that align with the trauma informed PA plan? And it's been really exciting to see this work coming together. Next slide, which I believe is questions. And I'll happily open it up for questions.
I have a question.
Yes.
So you just mentioned that some of the dollars you requested had funding, or it's in the process of all police officers being trauma informed, trained, and also de-escalation. Do you know if those programs have started yet, or do they have a start date?
I think they have to get started. I'm not going to give you the exact date because I'm going to be wrong, but I believe it's by the end of the year. And there's still some scrambling around that because, you know, when the legislature puts that was unfunded, so an unfunded mandate in place, and also doesn't have an idea of what that means in terms of which trainings you should take. We're trying to advise police departments and provide some free trainings for some that don't have any budget room, and some direction towards what trainings would be worth taking for those that do have a budget for it.
One last one, I promise, one last one. Do you have any type of diversion programs in lieu of arrest, and are they trauma-informed trained?
So I've been serving on our Juvenile Justice Task Force, which has been facilitated by the Pew Charitable Trust. And so we are about to release our recommendations as a task force, and it includes that we should have diversion programs in place and used more often consistently across all 67 counties of Pennsylvania. The inconsistency here, if you're going to get arrested as a juvenile, it better be in like Allegheny County near Pittsburgh, or who knows what's going to happen. You also don't want to get arrested in Pennsylvania if you're a boy and you have brown skin, because your outcomes are going to be drastically different today. And so we've put several recommendations forward around diversion, around taking some discretion away from judges so that it's the offense and your risk of reoffending that is deciding how much deeper you go into the system. We also have currently 18% of all of our juveniles in the juvenile justice system are there because their family can't afford to pay the fines and fees. And so we have a recommendation to eliminate the fines and fees. But in addition to wanting consistent and more diversion programs, we've also recommended that schools have in-school diversionary programs that do not lead to children being arrested out of school for a schoolyard fight or altercation and other minor offenses. We don't want that to ruin the rest of somebody's life. We also know that that tends to happen unevenly depending on which school district you're in and what the median household income is in that school district. So there are several recommendations that will be coming out publicly within the next few weeks, and several of them hit on your question. We're not there yet. I'm reading the adult prison system. Actually, it's been pretty positive. I'm meeting with someone from corrections next week to start planning for me to go in and do a training for their team around trauma-informed care. Several of our state prisons have added things like meditation and yoga and other sort of trauma tools within their prison systems. What's happened in Pennsylvania, which I don't think is uncommon in any system, not just state government, but any system, is that a lot of these efforts have been siloed by agency. And so there hasn't been a whole lot of best practice sharing or us all kind of working off the same playbook. And so the plan was really, not just the plan, but the creation of my office and putting it intentionally in the governor's office was really focused on how do we get all these players to come together and start sharing what they're doing and learning from each other. All right, we have about 1 minute left. Does anybody have anything else? I'm sure you've had a long day and it's late in the afternoon. That's the other thing about, I say during the COVID days, my brain has Friday afternoon brain by like Wednesday morning. Like I'm burned out Wednesday morning now. So I appreciate the fact that you're all even still here at 3:59 on a Thursday.
Well, thank you very much. That was really informative, and I'm sure everyone really enjoyed it. Just thank you.
Absolutely.
Yes, thank you, Dan. It's
And I'm going to put
been amazing.
I'll put my email in the chat. I'm happy to talk about this. And I've said I've done anti-poverty work in 3 states. I don't hate poverty in Pennsylvania. I hate poverty everywhere. I don't like trauma anywhere, and so I'm happy to help. And I learn every time I talk to one of you, and so I'm happy to compare notes, or if you have a frustrating day and you want to talk about something, if you just need a sounding board. I'm happy to talk to our neighbor